In this simulation, we have a patient coming down in respiratory distress. She is a 9-year-old female English Springer Spaniel, desexed, has otherwise been in good health. So I'm just going to make sure I've got everything here. I've got 2 masks, appropriately sized for the patient. I have the SpO2 monitor here and the machine is on. I've got a catheter here and catheter equipment ready to insert one straight away, and that'll be useful in case we have to give any medication IV or in case we have to give any bloods. Oxygen here obviously, and patient monitoring equipment here, and stethoscope ready also. So here we have in this simulation our patient in respiratory distress. So first things first, we're going to administer oxygen. So we're just going to see if she tolerates this. Now if the patient, like in this case, is really not tolerating the mask, then we can just do flow by oxygen and that's fine. So do you mind just holding that there? I'll just put the SpO2 monitor on the ear also, so we can monitor the oxygen in the blood.
Yes, yeah.
Good little girl. I've got the crash card here in case we need to use it. So I'm just going to take some vitals quickly, record them.
That's correct. Okay. I will resend that one. Sometimes our ebooks don't send correctly, or they don't send in time, but I will make sure that one gets sent out for you. No problem at all. Yeah, no problem. It should come through in the next hour or 2. And if it doesn't, maybe just block before we close at 6
I'm
o'clock.
also going to insert a catheter. So this is in case the veterinarian needs to administer any medications IV or if we need to take a blood sample. So I just have all my catheterization equipment here. You're the worst dog in the room. Stay there, darling. Bung. I'm just going to shave a little bit there. The SpO2 is slightly increasing with the flow by oxygen. Oops, sorry, that's a bit noisy. Let's record. Good girl. Do you mind holding off that vein? Sure. Thank you. Alright, good little girl. Go up. Very good girl. Good. So we've got a catheter in now. Just going to keep monitoring her SpO2. The vet will come through now and assess the patient. I also have an oxygen cage set up in case she needs oxygen therapy. So here is the O2 cage that I have prepared for our respiratory distress patient. I have the SpO2 monitor here. I have my patient monitoring equipment here and the crash cart here in case it is needed. So first I'm going to demonstrate how we perform a physical examination on a patient. So we have an 11-year-old boxer cross, female spayed, weighing 20 kilos. She's in good health. I think this is a body score of 4 or 5. Let's have a listen to your heart first and your rest rate. Up there. Rest rate is pant. Need to stop panting. Come here, my love. Sit. Good. There we go. Take a little listen. There we go. Good girl. Very good. There. Okay, come here, baby. And throughout the physical examination, if we can, we give treats just to make it a little bit more of a pleasant experience for the patient. Sit. Good girl. Good girl. So next up I'm going to look at our mucous membranes and papillary refill time. No more treats, baby. No more treats. Good girl. Okay, mucous membranes pink and moist, papillary refill time 1. This dog has quite a pronounced malocclusion, so an underbite, about a grade 2. She's just recently had a dental at the specialist centre, so at this stage I would grade her dental about a grade 0. She doesn't have many teeth left, but the existing teeth are looking good. Eyes are clean and bright. She has a little bit of nuclear sclerosis that the vets have noticed in the past. Ears are looking clean, skin NAD, good. Finally, we will grab the temperature. I like to do this last when we're doing the assessment because it's the least pleasant part for the animal. So we try and keep everything nice for them. I don't want to get them stressed early on in the assessment. And I reckon you're allowed some treats for this. Nom, 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 nom. You don't want this in your mouth. I think you know what this thing is. Come here, my love. Good girl. Split tummy out. Bottoms away. Good job, girl. That's a good temperature. You did really well. Good job. Okay, and she's also bright and responsive, so I think she's done really well for her physical exam. I'm also going to demonstrate how to administer oral medication. So in this example, we might be administering something like an oral meloxicam after food. This could be something like Panica. So what I would do with a little patient like this is just squeeze it down the side and it's done. So you did really well. Another treat for you. For the next example, I'm showing a dog suffering from toxicity who is then moved on to IVFT. So the patient is a 1.5-year-old female Beagle Cross. She's desexed. So to induce the vomiting, we use a drug called apomorphine. So there are several ways that this can be administered. It can be diluted down with saline and injected IV. It can be rubbed on the gums and absorbed through the mucous membranes. It can also be placed on the eyelid and absorbed through the membranes that way. Injectable can be a little bit stingy. The eye can also just hurt a little bit, so we find the nicest way to administer is just oral, so applying to the mucous membranes. From there we see some vomiting, and then once the stomach content is emptied, we administer Serenia. So this makes the patient feel a lot better and stops the vomiting.
Would you give Serenia after
Patient is given Metamide.
Metamide?
Yeah.
Do you prefer Serenia or Metamide?
I skip all that because it's cheaper. You could give either, but because we don't know if this is a toxicity or not, I probably give Serenia.
Good job.
check.
Try a bit of food. Good girl. You feel better? Very good. Okay, in this simulation we have a dog who has a bleeding wound on its front leg. So we have 3 people waiting in the reception area. We'll triage this patient because obviously this needs to be seen before the other appointments, which are routine vaccinations. So what I'm going to do is I'm going to apply first aid, stem the bleeding, and then also monitor for any signs of pain. Because obviously we'll need the vet to administer pain relief and then any treatment. So here's our little wound here. First of all, I'm just going to grab some melon. Apply pressure there, and we'll just hold that in place just to stem the bleeding. And then apply a pressure bandage and vet wrap.
For the puppy, I've got a vaccinated puppy as well there.
In cases like this, we may have a distressed patient, and in those examples we may need to use something like a muzzle for PPE for ourselves, and that's not unusual for a dog to sort of yelp or snap out in pain at us, so it's important that we protect ourselves as well. So I've got the little pressure bandage here, and this is stopping the bleeding. Good girl. So I'm just going to have a little listen to her heart rate. Okay. So in this patient we can note an increased heart rate. It's sitting at about 160, which is elevated for a dog of this size. So that's obviously a sign of pain, so I need to alert the veterinarian, obviously, immediately. Other signs of pain can include excessive salivation, so we're really, really stressed out, and also vocalising, so yelping in pain, and like I said before, maybe even being a little bit snappy towards us. It's not very nice for the patient. So I've got the vet here who's now going to check the patient over and we'll administer some pain relief for her. I'm going to demonstrate to clip a dog's nails. So this is a really compliant little doggy. We've got another staff member here to help hold, so we're using proper animal handling techniques. These nails aren't too bad. I'm just taking the tip off. I have a jar of Condi's right here, which is coagulant, so it'll stop any bleeding if we hit the quick. These are white nails, so I am pretty clear on where I'm cutting. So just the tips and the little jute cord. Ew. Other one. Pathetic little doggy. too much off these, they're quite short. Oh, sorry, baby. I won't even take it. One more little foot. Good. Yeah, I'm probably not going to even take any more off those ones because they are nice and short. Good girl. That's how we cook the dog's nails.